From the PEP Radio Newsroom, this is part two of yesterday's news blast about research leading to a cure for HIV. LGBTQ Nation is reporting a kick and kill strategy that may have actually cured one woman. A years-long study in Rwanda has yielded promising results with a strategy that researchers call kick and kill. HIV doesn't live in our blood. It lives in reservoirs, whether in the lymph nodes or the liver or the brain, so you need to kick it out in order to kill it. Krista Dong, an assistant professor also with the Ragon Institute, told NPR in August. In the study, 20 young women on antiviral therapy for an average of 7 years were asked to pause the drugs, allowing the HIV lurking in those reservoirs to emerge. Researchers flushed it out of hiding with a unique drug called vezatolimod, followed a week later by one-time infusions of broadly neutralizing antibodies, or BNABs. Those antibodies were predicted to bind to the virus and summon immune cells to eliminate it. By trial's end, 4 women remained in remission. One would later experience a viral rebound, while 2 resumed AVRs, or antiretrovirals, one to ensure a safe pregnancy, and the other because a new job precluded her ability to receive regular monitoring. More than 2 years after stopping medication, one woman remains HIV-free and off treatment. She could be cured. And then there are novel vaccines that can train the immune system to kill HIV. In tandem with research on a cure for HIV, an HIV vaccine is a priority for scientists. So-called novel vaccines are key to that effort. 2 research teams reported in May that HIV vaccine approaches aimed at training the immune system to produce specialized antibodies against the virus have taken steps forward, Paz magazine reports. Both studies showed that different engineered immunogens, substances that trigger a specific immune response in the body, could inspire production of precursor immune cells with the potential to produce those same broadly neutralizing antibodies, or BNABs, introduced in the Rwanda study to kill off diverse strains of HIV. We've now shown in humans that we can initiate the desired immune response with one shot and then drive the response further forward with a different second shot. William Schief, a PhD of Scripps Research, said of the Institute's study of 18 participants in South Africa and Rwanda. These trials provide proof of concept for a stepwise approach to elicit custom-tailored responses, not just for our vaccine, but for the vaccine field at large, including non-HIV vaccines. That second shot, or boosting strategy, is designed to guide the immune response along the path toward BNAB production. All those who received both the primer and booster ended up developing antibody responses. Most showed elite responses with multiple mutations linked to BNAB development. What really surprised us was the quality of the immune response we saw after just 2 shots, Schief said. We didn't anticipate it would be that favorable. That's a news blast for this hour. If you're watching our news content on YouTube, please be sure to subscribe to our channel. PEP Radio is available on the Live 365 app, the PEP Radio page at paequality.com, Roku, and Alexa. Up next is the Meadville area weather forecast here on PEP Radio.